We live in a world that is profoundly unequal. Half of the world lives on less than $2 a day. 1 billion people go to bed hungry every night, and 1 billion more don't have access to clean water. And despite all this, for the first time in history, the world has the potential to end extreme poverty, to provide the unalienable basic human rights described in the UN Declaration to every human being, regardless of race, nationality, or religion. The spread of information technology and the trends of globalization have brought the world closer than it has ever been, and global wealth is at an all-time high and rising. While the stage is set for successful development, investors want to be sure that their efforts are paying off and creating the desired results. Indeed, the world is searching for a successful model of rural healthcare that deals not only with the whole range of health issues that the poorest of the poor are grappling with daily, but also that empowers them on a permanent basis to be co-creators in claiming the rights they have long deserved. The Jamkhed Comprehensive Rural Health Project, active and highly successful for over 36 years in rural India, is such a model. The health of individuals and communities is largely dependent on their own actions or inactions. Therefore, the Comprehensive Rural Health Project, hereafter referred to as CRHP, chooses to work with those communities who truly want to improve their health and socioeconomic status. From its onset, CRHP has been based on such mutual participation, empowering people with the skills and resources needed to be caretakers for their own health and development. After completing their extensive training in India's prestigious Christian Medical College, residencies in surgery and medicine in Ohio, and a master's in public health from Johns Hopkins University, Drs. Raj and Mabel Arole returned to India to follow their dream of working with the rural poor. When they arrived in this drought-prone and poverty-stricken area of Maharashtra in 1970, they came with neither funding nor equipment, but carried with them their extensive educations and a deep commitment to serve the poorest of the poor. They offered their services to several districts, but at first none wanted their help badly enough to supply housing and a building to treat patients. Eventually, the people of Jamkhed found them, with villagers and local politicians and business people collaborating to provide the supplies and land needed for their roles to carry out their work. Despite the fact that most families eke out a meager living selling what produce they can accumulate, and few know where their next meal will come from, these villagers mobilized to create the facilities needed for the Aroles to begin work. In the same way that the Aroles chose Jamkhed for their home base, because of the initiative of this poor community, they also choose individual villages to work with based on the willingness of the village to be a partner in creating health. Because of this process of mutual selection, CRHP matches its resources and expertise with communities that are excited about receiving them and creating help.